gonna do a sterile dressing. So first I would check the doctor's orders and make sure that I'm doing the right sterile change on the right patient. And if the patient needs analgesics, I would give them 30 minutes before performing the dressing change. Okay, so then I'll go into the patient's room, knock, knock. Hi, I'm Kylie. I'll be your nurse today. We're going to be doing a sterile dressing change. So I'm just gonna make sure that you're the right person. So, Jenny Lind, born October 13, 2008. Is that correct? Can you confirm that? And then once I've confirmed them in 2 different ways, I can begin. So first, I would wash my hands. I would have done that first thing when I came into the room, sorry. And then put gloves on. Sorry. Okay, and then keeping her covered as much as possible. I would take a look at it, just examine it first and check for any drainage that's visible from the outside. And then, sorry, I would put a little pressure, not a lot because you don't want to hurt them because there's a wound under there. And I would just remove it. And if there's hair, I would go in the direction of the hair so that it doesn't hurt when I'm pulling it off of their skin. And then I would just pull the tape up towards the bandage, and just keeping a little pressure on there throughout the process. And then I just pinch it a little and lift it up away from the patient so that if there is drainage, they don't see it and freak out. And then, oh, I'm all shaky, I'm really sorry. I would remove these and assess for taco, so the, oh my gosh, type, amount, color, odor, and then if I had tweezers, but we don't, so I'll just remove the dressing and then assess the wound for any drainage or any colors or odors that are abnormal. And then we'll just remove the gloves, and then we'll get our sterile field ready. I'm going to lift it up a little so that I can keep it in my vision at all times. So we'll wash our hands again. And then, so we'll just open this and we'll open it away from us. Make sure to touch, oh shoot, the inside so that we don't contaminate it. Oh, what a struggle. And then, so, let's scoot this over this way. Grab that. And we'll open it up so that we can put our Q-tips and our other stuff on it. So I didn't have a closed one of these, so we'll just pretend I opened this and then put it on there. And then we'll open up our Q-tip practicing with these, so let's hope this goes better. Ah, okay. Okay, and so then we'll put our gloves on. I'm sorry, I'm actually gonna move this stuff out of the way and put my gloves on away from the sterile field. And open those up without and then we'll don our sterile gloves. Oh no, they're stuck together. Oh. Does not want to go on. Okay, then we'll get all our supplies and have it ready for any biohazard stuff. And oh, that was a close one. Okay, and then I'm just gonna pull these apart so that when I'm doing it, they don't get stuck together. Okay, and then scissors, another measuring thingy, and okay, and then we'll open this up, making sure not to cross over the fill. Okay, and then careful not to splash. Then we're going to clean the wound. So we're going to take one of our little 4x4s. We're going to just get it all nice and wet and wring it out. Then we're going to come over to our patient, keeping our sterile fill in our line of vision. And we're going to go from clean to dirty and not dirty to clean, so we don't contaminate it, because we do not want infections. So we're just, and don't push too hard while you're cleaning either, because it might hurt them. And also don't cross over the wound while you're cleaning it. So and I would go around, but for like filming purposes, I'll just stay right here and pretend I went around to clean it. Okay. And then I'll do one more of those to make sure it's nice and clean. Wring it out. And make sure you don't drip on your sterile field. And I wouldn't cross over that. Okay, and then we're gonna measure it. So first, without touching the wound, we're gonna measure the length of it. So it's about 13.5 pretty close to 13 and a half. And then, oh, I would not throw that yet. We're gonna measure the width of it. That also without touching the wound, and that's about 2.5. Okay, then I would get rid of that. Then we'll measure the depth. And going, so it's about 3 from the deepest part of the wound. We'll get rid of that. Okay, then we will pack the wound. And so we'll take some more of our gauze. And we'll open it up. And then we'll get it nice and wet. And wring it out. Oh shoot. And you wouldn't drip on the sterile field like I just did. Okay, and then we'll take one of our Q-tips. And we're just gonna carefully pack it in there without stabbing her or anything, just gently packing it in there. And you don't want it like hanging over the side because you don't want the wetness to sit there, and it can, because it can cause skin breakdown, sorry. And then this one's kind of contaminated now, so my Q-tip. Okay, and then we'll get that wet again. Or not again, because this is a different one. We'll get this one wet. Wring it out. And bring it over to pack into our wound. If I can open it back up. Wow, okay. And then just gently putting it in there. Okay. And then once the wound is packed, we can dry around the edges so that it doesn't cause skin breakdown, and just gently do this again so that you're not causing them any pain or anything. Okay, then we will, oh my gosh, take some of our 4x4. I'm just gonna gently place it over the wound. Making sure that it's covered. And I guess I'll just use all of mine just for extra protection. Okay, then we will grab this, pinching it away from you so you don't contaminate it. And then you're just gonna place it over the wound. Gently, just do everything gently so you don't hurt your patient. Okay, then we're gonna tape it up. And it might be a good idea to take off your gloves because I just destroyed that. Okay. And you want to have a little hangover of the tape so that it sticks nice and good. Oh, and if they have any hairs in the area where you're going to be taping, you can ask them if it's okay to shave or trim it so that it doesn't get stuck to it and cause worse irritation, especially when removing it. Oh, and I would not set this back into my sterile field after I touched it and used it and did all that fun stuff. Just get her all taped up. And then, oh no. you're all taped up, you would, at first you would assess their pain scale. I forgot to say that. On a scale of 0 to 10, you would ask them. And then after the procedure, you would re-ask them about, so like, how would you rate your scale on a, or how would you rate your pain on a scale from 0 to 10? And then you would get them all cleaned back up. I didn't even use my bag. And then you would make sure they were in a safe and comfortable position with bedrolls up if needed, with their call light, with anything else they might need. And you would ask them like, okay, is that like all you need? Like, do you need anything else, I guess? And then you would go back and document everything. And then after that, you would reassess and make sure that the procedure went well and that there were no complications or anything. And I hope that I remembered everything.